Hey, welcome back, parents. If you have ever taken care of a child who's sick or been sick yourself, and then all of a sudden your kid gets sick, or you have multiple kids sick at one time, and you feel like you've just lost it and can't maintain your sanity, you are not alone. This happens to all of us in parenting at one point or another. I've got good news because on today's episode, we have Dr. Brittany Todd with us. She is going to share some really awesome tips for maintaining sanity when you're taking care of sick kiddos. We need that. So, welcome to the show, Dr. Todd.
Thanks so much, Jordan. I'm so excited to be here.
Yeah, guys, Dr. Brittany Todd, she's a clinical pharmacist. She's the founder and CEO of Sacred Heart Clinical Pharmacy Specialties. And she's also a devoted wife and a mom of four. So, not only the professional on the side of medication management and managing fever and pain and all the things, she also has practical experience because she's got four kids under the age of 10, right, Brittany?
Exactly.
This is the real thing. You're
Yeah,
living it out there.
I
And
am.
Brittany's husband is a lieutenant paramedic with the local fire department. They love vacationing to the beach or the mountains, playing outside with their kiddos, glass of wine on a hot summer night, and
Oh,
learning
yeah.
more about their Catholic faith. So we're so glad to have you on the show, Brittany.
Well, thanks so much for having me.
Yes, yes, yes. Okay, let's dive in because managing sick kids is a real difficult thing. And
Yeah.
it can feel like, in the middle of the night when your kids are sick and you're sleep deprived because you've been up caring for them. Like, I just remember thinking, have I given medications in the last hour?
Oh,
And
yeah.
who did I give it to? And what's going on? So, you've created a tool to help us maintain some sanity when we're taking care of kids. So, jump right in and tell us about kind of your story, what was going on in your own life that prompted you to create something to help parents and grandparents and babysitters and everybody that's taking care of kiddos.
All the people. Well, what happened was, I've been thinking about this for a while, but I have four kids. And my infant, who's about 9 months old right now, keeps getting fevers, just as normal. They get a cold, they get a fever. They get a cold, they get a fever. And all of my kids are like this. They get a cold, they get a fever. Now, my kids, not everyone's kids, get extremely high fevers, like
Mm.
103, 103.5. Like we're kind of hitting that threshold of like 104, take them to the hospital, and I don't want to hit that. So I do the cold compresses, I try the cool socks, I try the, taking off their clothes, the other things that I can do that are not medication related that I could possibly use to get their fevers down. But sometimes you just got to give them the medicine.
Yes.
And I was I was woken up by my, at the time, 7-month-old just a couple months ago in the middle of the night, because it's always in the middle of the night. They wake you up and it's like 3 a.m. and I'm rocking him in the chair and I'm like, I grab him, I nurse him. But the first thing I notice is this kid is just like radiating heat. No wonder he's awake. So I'm nursing him in the rocking chair thinking, okay, I have to give him some medicine. What dose do I give? How much did he weigh when he was at the doctor's office last? Okay, I think he was about 16 pounds. I've got smaller kids. So he's about 16 pounds. What is that in kilograms? My pharmacist brain is going. And then what's the dose of Tylenol? I have Tylenol in the closet. What do I give? And I'm literally sitting there at 3 a.m. going, I'm too tired
To
to think
figure
of
this
this.
out.
This is
Yes.
insane. And I'm a pharmacist. I know the dose. I don't know the dose off the top of my head, but I know the dosing range. I know that it's, 10 to 15 milligrams per kilogram per dose. But now I'm thinking, well, how many kilograms is he? And what is that times 15 to get the right dose? And then how many milliliters is that? It's 3 a.m. I can't do this, right? I mean, I
Yes.
can, but my brain, it's going to take me 10 minutes to get my brain awake enough to figure this out. And I was sitting there rocking him in the chair trying to figure this out, going, why don't I have a reference that just says the kid is 16 pounds? Give him this much Tylenol. And then I
Yes,
was like, wait a
exactly.
second. Why don't I make something like that? I'm a pharmacist. I can make that. Why wouldn't I make that and make it super convenient, not just for me, but for everybody else? And I'm not the only person in the world who's sitting there at 3 a.m. going, oh my gosh, I don't know what to do. And I'm a pharmacist. I know the dose. Most
Yes.
people are sitting there going, I don't even know the dose. Where do I even begin? I know they need Tylenol. I can't call the doctor. The bottle says ask a doctor. They're under 2 years old. I don't know what the dose is. And you don't want to wait 5 more hours or 10 more hours for the clinic to open. And who are you going to call at 3 a.m. and figure this out? So then I think most people probably guess, which is not safe, right?
Yes.
They're like, if that's the dose for this kid, maybe my kid's half that dose. So they might underdose or they might overdose, and that's not safe. So I thought, I'm going to make a dosing guide that literally says weight by weight. If you're 21 pounds, this is how much dose you get. If you are 30 pounds, this is how much of the medicine you get. So I made it for ibuprofen and Tylenol products. It includes the suspensions. It includes the rectal suppositories. It includes chewables for kiddos. So really anything that a kid would use. Those are the tables that I created. My sister created it with me. We're both pharmacists. So she actually works at a school of pharmacy here in Colorado and teaches the pharmacy students how to be pharmacists. And both of us have thought of this, kind of brainstormed it together and created this dosing chart. So then within this dosing chart, the other really cool thing that I thought I need in my life to keep my sanity as a mother is a dosing schedule, right? Like my kid
Yes.
woke up, my infant woke up at 3 a.m. and had a fever. So I just gave him Tylenol at 3 a.m. And then, 5 a.m. rolls around. I'm like, when did I give him the Tylenol? How much did I give him? Was it Tylenol or was it ibuprofen I gave him? I can't remember which one I gave him. That's
Yes.
not safe either. So we came up at the end of the book, we have 20 dosing schedules. And you can literally write down your kid's name, their weight, what time you gave what medicine. So that way you know when you gave it, how much you gave, and when they're due for the next dose. And this has been incredibly helpful because just last week, all 4 of my kids had fevers of 103 for like
Oh,
a week, but like at different times, right? One started on one day, and then 2 days later, the next kid got it. And then 5 days later, the next kid got it, right? And I'm like, I cannot keep track of one kid, let alone 4,
right.
trying to figure out Tylenol, ibuprofen, dose, who's 4 milliliters and who's 3.5 milliliters. So in the book, we have a dosing chart, and I can show you, like, this is our book.
Yes.
Just if you're actually watching this podcast, there's a little gray thing on the cover because it says not for resale, because I actually don't have a copy of the actual book because I'm the one who wrote it and
Yes.
haven't ordered a real copy. But this copy is the exact same other than the, gray bar
Gray
across
bar
it.
on the front.
But
Yes.
if you go to the back of the book, there's a sample dosing guide. So you can actually look at what you may want to mark down on these dosing charts. And then you flip the page and you can see these blank dosing charts, and it says what's the name of the child, so you know which kid you're dosing on this chart. And I would recommend just one chart, one page per kid, so you're not mixing them up. And then you can mark, I gave acetaminophen, which is the generic for Tylenol, and I gave 4 milliliters at 3 a.m. And I have a little note section. You might want to write like they had a fever of 103.8, so you can just keep track of how high was their fever, or if there's anything else going on. They had pain, they're complaining of an earache, or who knows what you would write down, but something useful if you find it useful. So here's an example of my kiddos just last week. So if you look at this, if you're looking online, you can see that I marked that Luke was 17 pounds on the 13th of May. I gave him ibuprofen 3.5 milliliters at 12 o'clock in the morning, so midnight.
Yes.
And then I just kind of, wrote the next dose would have been acetaminophen, then the next dose is ibuprofen. The other really cool thing about this dosing chart that's in this booklet is not just for my sanity, but if I have to go somewhere, and I was the one who was dosing the kids all night long, and I have to leave the house, now my husband takes over the dosing of it, and he's like, Britt, which med is Luke due for? Or which med is Evelyn due for? And what dose? I don't remember the dose. And I'll just say, well, just grab the dosing chart and you can easily see what's next and how much they're supposed to get. So super easy. And I actually gave this to my mom the other day because she took my kiddo. One of them, I think it was Isaac. She took him when he had a fever because I had to go somewhere, and she took over. And I just handed her the book and I handed her the medicine and was like, here you go. And she didn't even have to text me or call me or anything. She was like, that was the easiest thing I've ever seen. It just was like streamlined transition between caregivers. And
Yes.
it's helped my sanity so much. Even as a pharmacist, I'm like, what dose is next? I cannot remember this.
Right. It's so much better to have it written down because you can
Yeah,
trust that the facts, right? You put the facts
right,
down on the dosing chart and then you can refer back to it when your head is spinning and you are
right,
like sleep deprived and you don't know which way is up.
right, right. And all you have to do, I can show you these again. People who are watching, I have these dosing tables, and they're super easy to read. That
Yes.
just says how you just find their weight and you go over the line, and that's how much you give. And we give a dosing range because it's all pain and fever medicines for kiddos are dosing range. It's 10 to 15 milligrams per kg or 5 to 10 milligrams per kg, depending on which product you're using. And instead of figuring all of that out, you can easily just find the weight, find, oh, it says, I can give anywhere between 2 and 3.5 milliliters. The 3.5 milliliters would be the higher dose end. Still within range. You could give the lower dose or the higher dose. Personally, my kiddos have such high fevers, they don't respond to the lower dose like they do to the higher dose. And they're so miserable that I usually go with the higher dose for fevers. If it's pain, like they had, I don't know, an ear infection, their ear's a little achy, that actually responds for my kids on the lower dose. So I prefer to give lower doses if I can, but I've just learned over time that the higher dose is what they need. So we give a range. You can decide, and whatever you decide within that range is fine. That's the recommended dose for the kid at that weight. And one thing, if you're sitting there like me with a 9-month-old who hasn't been to the doctor since he was 6 months old, and I'm like, how much does this kid weigh? He was 16 pounds back then. I don't know if he's 17, 19. Maybe he's
Right.
eating a ton. He's like 22 pounds. I have no idea. The nice thing about that range is you can kind of guess, okay, he was 16 pounds 2 months ago. He's probably 17 or 18 pounds right about now. I don't want to overdo it, but I also don't want to underdo it. So maybe I'll just kind of choose right in the middle of that dosing range
Okay.
because that makes me feel more comfortable with that weight. I know he's right about there. It's probably a good, you know, happy medium in the middle, right?
Great. Great
Choosing a
advice.
range right in
Yes.
the middle.
Yes. So and I suppose what you could do, which I've done in the past, is like, I don't know how much they weigh. I haven't taken them to the doctor in 6 months. And so it's like
Right,
I weigh myself on the scale and then I grab my baby and I jump on the scale with my baby and then
right.
I subtract the difference and go, okay,
Yep,
they're 18 pounds. Great. I
yep.
feel better
Right.
about that.
At least, yeah, you're close, right?
Yes. You talk about Tylenol and ibuprofen, that these are the
Yeah.
two main ones that you have on the dosing chart.
Mm-hmm.
And I know there's probably some new moms too that haven't kind of heard about, alternating Tylenol and ibuprofen, but that's
Yeah.
like a thing. I remember learning that when I was a young mom and I was
It's
thinking, oh,
amazing.
yeah, I was reading the bottle and I was thinking, oh, I can't give another dose for 6 to 8 hours.
Yeah.
Like, I think that, this is wearing off before then. And
It
then my
does.
pediatrician said, yeah, you can do something different. So tell us about that.
Yeah. So my kids, after about 3 hours of the medicine, their fevers start creeping back up and they start feeling yucky. You could tell, Mommy, I have a headache, or Mommy, I don't feel well, or they just start getting really tired, whiny before the 6 hour mark. Because you're not supposed to give Tylenol any more than every 4 to 6 hours.
Okay.
And ibuprofen is 6 to 8. So I just go with 6. That's the common denominator between ibuprofen and Tylenol, 6 hours apart, right? So that means that if you give Tylenol at 6 a.m., you should not give it again until noon. And then you
Yes.
don't give it again until 6 p.m. And then you don't give it again until midnight. You get about 4 doses a day, right?
Right.
Every 6 hours. But if it's wearing off at 3, the cool thing is ibuprofen and Tylenol. I say Tylenol, that's the brand name of acetaminophen. It's just most people call it Tylenol, most people call it ibuprofen, which is the generic of Motrin and Advil. So I don't know why we do that. But if it starts wearing off, you give the kid Tylenol at 6 a.m. and around 9 a.m., they're starting to feel crummy again. They're not eating, they're drowsy, just feel yucky. You can give the ibuprofen because it's 6 hours between its own medicine. So Tylenol and Tylenol. You can give ibuprofen 6 hours apart from itself, but you can give it in the middle.
Nice.
And that way, every 3 hours, they're getting a medicine. And that's what I have to do with my kiddos. I don't know why my kids get such high fevers, but they do. And it wears off at 3 hours. So every 3 hours, for like a good 2 days, sometimes I have to give them medicine. So I will actually wake myself up at midnight and say, where am I in this dosing chart? Okay, they're due for ibuprofen. Pull up the medication in the syringe. I walk in my kid's room and I wake them up and I say, here it is. And I mean, they're like half awake. They don't really wake up. They don't remember me coming in, but I'll go in there and I'll give them their dose every 3 hours, because if you don't, this is how pain and fever work.
Mm.
If you don't keep that pain or that fever under the threshold, and you allow the medicine to wear off to the point where it's above a threshold, it's
Yes.
harder to get it back down to the threshold. So if you give Tylenol and you wait 6 hours to give ibuprofen, it's like you're trying to catch up to push it back down to the tolerable level. But if you just keep giving medicines, and it never quite goes above the threshold of pain and fever, they maintain feeling better the whole time. It's kind of like diet too, right? Like sugar, if you eat too much sugar and you don't eat enough sugar, it's those ups and downs, waves. The same thing with pain and fever. So if you do
Yes.
it every 3 hours, but you're alternating meds, you're not overdosing, you're just treating wisely.
Yes. It's such a great idea. And I bet
Mhm.
there's grandparents that are going, "Oh, I didn't know I could do that for my grandkids. Like I don't have to wait 6 hours and
Right.
sit with them while they're miserable for the last 3 while we're just
Right.
waiting for the time to expire for the
Well,
next ibuprofen dose."
and some people realize that you can take Tylenol and ibuprofen together because they work completely differently in the body and they're eliminated differently. So you don't have to worry about overdosing pain medicine as long as you're staying within the doses of each of them individually. But you can take them together. And so most people think their fever is 103.5. I'm going to give both at the same time. Don't do that, because now you have to wait 6 hours for both of them
Oh,
and it's going to wear off in 3 hours. This actually came up with my cousin today. She just texted me about like a toothache. And she's like, I just took Tylenol and ibuprofen and it's been 4 hours and it's wearing off. I don't know what to do. And I was like, take one in 2 hours and then wait 3 more hours to take the next. You need to alternate, because she's getting past that threshold and she's spiking, and it's going to be harder to get it back down. So, I
mhm.
mean, this is good advice for adults too, right?
Okay.
This booklet, this dosing guide is for infants and children, about 12 years and under, because 12 years and over is when you can just take an adult dose, and it's easy to be like, here's your Tylenol, right?
Right.
But it's good advice for the every 3 hours for adults too.
Great to know. And tell us the difference kind of between the two medicines. I mean, if it's just pain, no fever, what is your preference for
It depends
pain?
on what the pain is. So for me, if it's just achiness, Tylenol does fine. And I
Okay.
like Tylenol. It's a little more benign. That one's eliminated through your liver. So if someone has liver issues, we may be a little more cautious with using Tylenol. Most kids don't have liver issues. Some kids do, maybe they're a liver transplant or something. And those would be the kids who don't go off of my guidance, go off of your doctor's guidance, right? And parents of kiddos who have disease liver, or transplant or whatever, are already going to go to their doctor first before they go to my dosing guide. Ibuprofen is better for more of an inflammatory pain. So if they smash their arm on something and it's inflamed, or maybe they worked out too hard and they just feel inflamed and achy, who knows what could be causing the pain. Ear infections are usually an inflamed eardrum, so ibuprofen often works a little bit better. I do want to say the caveat, though, that kiddos under 6 months old is Tylenol, unless the provider says otherwise, because Tylenol has been studied in little kiddos, in infants, 0 to 6 months old. Ibuprofen is not technically recommended without a doctor or a pharmacist. You could always call up a pharmacist and ask to, and they can give you a dose. Generally, if they're under 6 months, you would just do Tylenol. That's a little difficult because if your kiddo like mine is 5 months old and I'm pretty sure my whole family got RSV for the first time ever this year, and he got it too. And his fever was just sky high, and all I could do was Tylenol. And after 3 or 4 hours, I'm sitting there with the washcloths and trying to make him feel better, but I didn't want to give him ibuprofen until I wanted to just call the doc and just make sure. And then he said, yeah, you can give it to him. Just make sure you're dosing it correctly. But in general, under 6 months is just Tylenol. And then for inflammation, ibuprofen may be better, Tylenol for just aches.
Got it. So they're sick, they have a fever, they're complaining, they're whining, they're not feeling good. You would just go with the alternating every 3 hours,
Hmm.
Tylenol,
Yep.
ibuprofen,
And
tracking it.
sometimes I'll kind of wait it out and be like, okay, you got 3 or 4 doses of the meds over the day. Let's see how you look at like 4 or 5 hours.
Mhm.
Check your temp before I give you your next dose. Just, I don't want to keep them on the medicine for days on end.
Yes.
The other thing I have issues with my kiddos is when their fevers spike, they throw up. So if it spikes in the middle of the night, we're dealing with not just a sick, yucky feeling kid, but now we're dealing with laundry. And I'm just, it's hard. So that's why I wake myself up every 3 hours, at least during the night. When I trial extending the dosing period to like 4, maybe 6 hours, it's usually during the day.
Daytime.
'Cause
Great.
I don't want to
Right.
deal with the vomit in the middle of the night.
Yes, that makes so much sense. These are good tips for maintaining sanity, right? It's like
Yeah.
in the night, you wanna keep them on that schedule and that regimen so that they stay asleep, so that you're
Right.
ahead of the pain.
So if they're
Yes.
up just moaning and feeling yucky, that's not healing, that's feeling yucky. So my
Mhm.
goal is to at least give them a good night's sleep, and then we'll experiment the next day, right? See if we can
Yes.
kind of wean you off the next day.
Yes. What is the fever threshold now? Because I remember, like, it changed recently or over
Yeah,
the
it's
last few years.
104. They say talk to your doctor. And
Okay.
some docs will say, I mean, there's not much we would do other than give your kid Tylenol in the hospital anyway. So just give it at home. The reason we want to watch it is especially younger, under 2, there's a risk of febrile seizures. So seizures caused from a fever.
Yes.
If a kid's fever or temperature increases dramatically in a short amount of time, it increases risk of seizures. And that's a medical emergency. You got to call 911. They take them to the hospital. They get their fever and the seizures under control. And that's scary. So for me, when I'm about 103, I'm like, I'm not messing around anymore. I'm just going to give you medicine. I tried
Yes.
the cool compresses. I tried all the things and it's just not working. You obviously are miserable. I'm miserable. We just need to get this taken care of. If you send them to the hospital, they're going to give you the same meds you can give at home. But
Mhm.
if you wait too long, then now they're giving seizure meds, and that would not be good either.
Right. So what
Yeah.
is the low end of a fever that indicates medication being used then? You said like 104 would be
That's definitely the high. I think that's up to the parent, really. I mean, if I have kids, sometimes my kids get a fever of 99.9 and they're acting totally fine, I'm not going to give them anything. But if they're just like writhing on the couch, they won't eat, or they throw up because they're feeling so yucky and their fever's 100.8, I might say, I'll give you some medicine just to make you feel better. I don't want someone just miserable when I can do something about it.
Mhm.
Obviously, after I tried the other things, right? I always try to cool them off in other ways, but it's really up to the parent. I know some parents who won't give their kids medicine until they're over 101. I know parents who will give them medicine if they even think about a toothache. So, I mean, you could be on either spectrum. As long as you're giving a safe dose, it's okay. You just don't, I'm not a fan of giving meds all the time just for no reason. So just, use your judgment.
Yes, and we just heard your sweet little cherub in the background.
Oh, I know.
Well, this happens. We're moms. We have
I know.
kids and we work and we're on podcasts. So I
We're
love
on
it.
podcasts at home. The other
Exactly.
thing I wanted to mention about the book is it's very specific dosing. So if you look at one of the tables, it says, I'm pulling up the Tylenol table, and maybe I go to 18 pounds because that's what my kid weighs right now. So 18 pounds, it says give 2.6 to 3.8. That's pretty specific. And most containers come with like this dosing cup. And
Yes.
I don't know if anyone can see, but if you can remember, a dosing cup says 5 mLs, 7.5 milliliters, 10, and 12.5. Like, how are you going to get 3.8 from a dosing cup? I am never a fan of a dosing cup unless it's an older kiddo and they can swallow it easier and your dose is 5 mLs. Because even on the dosing chart on the bottle, on the box or the bottle, it says, I can pull it up. Let's see, Tylenol, it says for 4 to 5 year olds, 7.5 mLs, or for 2 to 3 year olds, 5 mLs. And sometimes your, let's see, 4-year-old does not weigh 35, 36 pounds like mine. She's small. She weighs 30 pounds. So she's technically in the weight range of the 2 to 3-year-old, but she's in the age range of a 4 to 5-year-old. So this box does not help me because I am technically overdosing her if I go with the 4 to 5-year-olds because she doesn't weigh what normal 4 to 5-year-olds do. So I usually go, before I developed this book and figured this out in my brain, I would pour the medicine between 5 and 7.5. And it was just a shot in the dark. And even as a pharmacist, I know everyone's doing this. If
Right.
I'm doing this, everyone else is doing this too. And that's not the best thing to do, right? So what I did is I just go to King Soopers or Walmart, literally any pharmacy in America will give you dosing syringes for free if you ask them.
Oh,
So I just went into King Soopers like a month ago and just to make sure I'm not crazy, because I used to work at King Soopers when I was interning in pharmacy school, and we gave them away like candy. People would say, "Oh, I'm buying Tylenol for my kid. Can I get a dosing syringe?" Sure. So I got at King Soopers 2 different dosing syringes. I have a 10 milliliter dosing syringe and a 5 milliliter dosing syringe, and they have hash marks on them. Every 0.2 milliliters is marked on these syringes. So I can easily go to 3.8 milliliters by pulling it down to the 3, almost 4, hash mark, the 3.8. Now, if you're not super comfortable with hash marks, find the dosing range. And if you realize that kid, the dosing range is 2.2 to 3.8, I'll just do 3. That's close. It's in the middle. Just choose
okay.
it and go with it. But I recommend, instead of using dosing cups, to actually get a 10 ml or a 5 ml syringe, because it's just easier to give them the right dose. And oral syringes are also easier for probably 3 and under than a dosing cup, because I can't tell you how many times I've gone in with this dosing cup at 3 a.m. to give my 2-year-old his medicine, and he just spills it all over him because he's half asleep, not
Yes.
really knowing what's going on. And I'm like, just drink your medicine. And it just gets everywhere. And I don't know how much actually got in his mouth. Right.
Yes.
And if that's the case, I can't give you more. I don't know if you drank all of it or if it's just all of it's on your lap. Right.
Right.
But this dosing syringe, I can stick it in his mouth and I know it's going in a lot
Yes.
easier than the dosing cup.
Yes. Great advice to just use the dosing syringe. It has a lot more accuracy because of
Right.
the hash marks versus that 5
Right.
to 7.5
Sure. Somewhere
range.
in the middle there, I hope. Yeah.
Yes. And it'd be good to, have several extras of these so you can have one in the diaper bag, in your
Uh-huh.
purse, at grandma
Yep.
and grandpa's.
So I have a little bin, like a little, I don't know, caddy in the linen closet that has the children's ibuprofen, infant's ibuprofen. Don't let me forget to talk about infant's ibuprofen. And then the children's Tylenol. And I have in that dosing syringes. And I have in that my dosing guide and a pen,
Yes.
because I pull this out every time someone gets a fever now. And I make sure, because sometimes I'm like, oh, it's just a one off. They don't have a fever. It's fine. I'm like in denial. Please don't be sick. And
Yes.
then inevitably they're actually sick and I have to use this. So I just, every time someone has a fever now, I pull it out and I write it down so that I know what dose I just gave to a kiddo.
Yes. You know what
So
I
it
love
just,
about that also is when you go to the doctor, let's say this goes on for 3 days, or
mm-hmm.
all of a sudden it's 3 months later and you're like, my kid's been sick like 4, 5
Yeah.
times.
Yeah.
Then you could take that with you to the pediatrician and be like, these are the dates he's been sick. This is what's been going on.
Yeah.
And that's just evidence of kind of the history of the child over the last 3 months. Because when you go to the pediatrician's
Right.
office, if you are stressed or something happened right before you got there, you're not remembering these things. And they may say, "Oh, how many times has he had a fever in the last 3 months?" And you're like, "Twice." And it's been like 9.
5.
You know,
Right.
right.
Right. Or like ear infections, they come and go. We don't always treat ear infections. I think most people think, oh, ear infection, you go to the doctor, you get antibiotics, but most of them are viral. We don't have to treat them. But if you're getting multiple ear infections over and over again in a year, it might be a tonsil issue and you need to fix that, or strep throat. You've got something going on that's like causing these constant problems. And yeah, this would help you go, oh yeah, they did have a fever in February and March and April and in May. Maybe there
Yes.
is something going on, you know?
Yes.
And
keeping
our
them.
lives are so busy, it all just kind of melds together sometimes. Or you might not realize that one of your kids has been sick every time everyone got sick versus one of your other kids like got sick the one time, right? So you
Yes.
don't, not everyone in the family gets sick at the same time every time. So I know my oldest doesn't really get sick much anymore.
Mhm.
She's 10. She's like finally getting an immune system. But the other ones always get sick every time someone gets sick. So it's nice to know who's sick and when.
Yes.
Yeah.
I think that this is brilliant. You have the medical expertise behind you, the schooling, the dosing as a professional, as a pharmacist, and the personal experience as a mom to know like what's out there, what you've already tried to keep track of things, how to give them, like you said, the most accurate dose. Because you mentioned one thing, like you could be underdosing them, and it's like that
Well,
would
if you
not be good.
underdose them, they feel miserable. Or I mean, worst case, they have a seizure, right? Hopefully
Right.
that's not the case. But worst case, they get a seizure because you didn't give them enough medicine. But we also don't want to overdose them. So that's why there's a dosing range. Just stay in that range and you won't overdose your kiddo, right? And if you're,
Yes.
again, not 100% sure of the weight, maybe stay in the middle of the dosing range, right?
Yes.
One thing I
Yes.
wanted to mention talking about overdosing is on the market, there's only one type of Tylenol or acetaminophen. It's infants and children's acetaminophen. It actually, oh, it doesn't say that. I thought it did. It's infants and children. There's just one type, and it's
Okay.
160 milligrams per 5 mLs, same concentration. There is no separate concentration for Tylenol. So that one's easy. You grab your suspension, you find the chart for Tylenol suspension, you can easily find it. But what I want to mention is on the market currently, and hopefully they change this because it's a safety concern, not because of my book, but because this is a state like the FDA has approved 2 different ibuprofen suspensions. There's a children's ibuprofen suspension and an infant's ibuprofen suspension. So the infant's has more medicine per milliliter than children's. And the reason for that is because babies cannot take as much fluid, right? I don't know if you've ever tried to squirt 5 milliliters into a baby's mouth, like a
That's a
6-month
lot.
old or an 8. Yeah. My baby just chokes and chokes and chokes. So if I'm trying to dose him with the children's ibuprofen, I have to give more um, fluid to get that medicine in him. So they made a more concentrated infant's one. So less fluid, but more medicine. So I only have to give him like 1.25 milliliters of the infants to get the same dose as maybe 3 milliliters of the children's. That way they can take it better. The problem is people don't really know that there's a difference, and they may try to dose the children's dose, 3.5 milliliters, with the infants, and that's going to double their dose. So in our book, again, we're trying to be really, 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 really clear and really safe in here. There's like a warning sign before you get to the ibuprofen page. And then when you open to the 2 charts for ibuprofen, we actually have the infants and the children's on the same page when you open the book. So you'll see a purple chart for infants and an orange chart for the children's. And you should hopefully say, wait, why are there 2 ibuprofens? Which one do I have? I have infants, 50 milligrams per 1.25 mLs. That's the bottle I'm using. That's the chart I will use. And then if you have children's, you're going to go with the children's one, which is 100 milligrams per 5 mLs, and you'll use the orange chart. The other thing is on that orange chart, we have a caution, do not use infants ibuprofen. Caution, caution, caution. Just make sure you're choosing the right dosing chart. And this is simply because the FDA has allowed 2 different concentrations on the market. So we want to make sure that you're not overdosing your kid. Because if you use this children's chart with infants, you're going to double the dose you give them. And you don't want that either. The inverse of that is if you have the infant's ibuprofen and you have the children's ibuprofen, but you use the infant's chart, you're going to underdose them by half. So just make sure, again, this dosing guide is very clear. Make sure you're using the right product with the right dosing chart, and then you'll be fine. Just
That's
make sure
right.
you're paying attention.
So there's 2 types of ibuprofen, the
Mhm.
infants and then the children's. An
Yes,
infant is, like you said, there's more medicine
in a
and
smaller amount.
a smaller amount. I'm just thinking, how many times have I given my, you
I
know,
know.
older child the infant dose and probably, and vice versa
Yeah.
because I just wasn't looking, or I thought it
Well,
was
I
just
used
ibuprofen in general.
Yeah, right. And I used to not even buy the infant's ibuprofen. I just had children's ibuprofen because you can dose an infant with the children's ibuprofen just fine. I mean, it's still as long as you know the concentration and you look at my chart. I
That's right.
mean, 18 pounds is 18 pounds. So you just find it if you have the children's one, you choose 18 pounds on the children's chart. So you can use children's with an infant, but my latest kiddo, the 9-month-old, will not swallow medicine. I think there's something about the ibuprofen children's that is syrupy. So not only is it more than he's used to getting all at once, but it's also really sticky and syrupy. And he starts like spitting and coughing because it's just, I mean, he doesn't drink juice. He
Right.
nurses. So that, I mean, he doesn't really get anything that like syrupy, right?
Yes,
And
that
so I
makes
think
sense.
it's a thinner medicine in the infants and it's a smaller amount so he's able to take it. It's more watery than the
Yes.
children's. And my other kids it didn't matter. They took it just fine. But
Y-
this one in particular, I have to buy infants ibuprofen for him to take it.
Yes, and they do start flavoring it like mixed berry.
I like to point out not every parent is sensitive to this, but my kiddos are very sensitive to dyes, especially red dye. And I always go for the dye free. So they make like grape Tylenol, suspension, and it tastes great, but it is full of red dye, right? That's how they make purple. Red and blue dye makes purple. And even my daughter, I didn't realize I had bought the wrong one the other day. And my 4-year-old was like, Mom, doesn't that have red dye in it? Because she knows she's not supposed to eat anything orange, purple, red, or pink. And
Yeah.
she was like, Mom, that's purple. Doesn't that have red dye in it? And I was like, man, I bought the wrong one. Still works. That's fine. But if you don't want dyes, you can just type in wherever you're buying it. Walmart, Walgreens, King Supers, Amazon, just type in dye-free children's Tylenol and it'll
Yes.
pull it up. And then I do want to note that generic and brand name, no difference.
Thank you for saying that because there
Yep.
sure is a price difference. And with
Yeah.
all of the crazy inflation that's been going on,
Hmm.
I'm always like, yep, I'm going to go for you know, the
The
off
generic.
brand.
Yeah. That's
Yes.
what I do. I just buy mine on Amazon, but that's just because it's easier for me because it's easier to not go shopping when I need the medicine. So I
Yes.
also keep a stash in my closet. So at 3 a.m. I have it because there's nothing,
Yes.
again, worse than waking up at 3 a.m. and realizing you don't even have medicine for your kid.
Right.
So I just have a bottle of each in the cabinet just in case.
Yes. I liked your idea too of having a caddy where you have the medicine syringes, the medicines, backup medicines, the thermometer, and
Yep.
your dosing guide with a pen there,
Hmm.
because then you just grab the whole little caddy out and there you go. You got
Hmm.
everything you need, put it right back so you can find it every time.
Yep. The
If
goal of the book is to get you to dose your kid within 2 minutes. I don't want you sitting there for 10 minutes Googling what dose or trying to figure out who can I call at 3 a.m. to get a dose. I want you to just think, no, they have a fever. Oh, the dose is 3.5. Go find the Tylenol, pull it up, and give it to them.
Yep,
Done. Like 2 minutes, go back to bed, right? Or at least
exactly.
snuggle your baby. Because I mean, while your baby doesn't feel well, you have to put them down to do all of this, right? And they're
Yes.
just screaming in bed, feeling yucky. So the goal is just within like 2 minutes, get them their meds and hopefully they'll feel
Yes.
better.
Yes. Yes. And tracking, I just can't underscore that enough. It's so
Yeah.
important. It also helps as a parent to not feel guilty because you're going, I don't know if I gave it at the right time or I didn't give it at the right time, or grandma's going, I don't remember. I think it was at midnight that they woke up and I gave him this. It's like, nope, it's all in the book. It's written
Yeah.
down
I
and no
need
one
to
has to
know.
feel bad.
Yeah, I need to know. And if you take them to daycare, most daycares don't want them if they have fevers, but some will take them or, you know, you have some sort of caretaker. And that's where kind of that notes section in the dosing schedule is nice because they could say fever of 102, fever of 101, or fever of like 99 because now you got it down and you're just maintaining the every 3 hours until mom gets them or something, you
Yes.
know.
So good, so good. Okay, listen, this pain and fever medication dosing guide is available on Amazon. Okay.
Mhm.
I've pulled it up. I'm like, I'm getting it for my niece. She has a newborn baby. This would be perfect to just send right from their little shop to my niece. It's gonna arrive on
Yep.
her doorstep in like 2 days, and boom, she can have what she needs for her baby. But we're talking like baby showers, get it for grandma and grandpa when you have a baby so that they have their own copy. I mean,
Yep. Get your own copy.
yeah.
Yeah, anyone who has a little kid has gone through this 3 a.m. thing. My sister, the one who helped me write the book, her 4-year-old didn't have a fever until he was like 3. So
Wow.
she's like, "I don't understand why you keep waking up at 3 a.m. with these fevers." And she's used it now on she now has 3 kids, and her 4-year-old now is in school, so he's getting fevers.
Yes.
Right? You get sick when you start going to school. So now they're all catching whatever bugs they're getting from school, and she's like, "I cannot believe how much I have used this book already in just the last 2 months of development." Right? It wasn't even published yet. We were just using our own copies. So it's
Yes.
incredible how useful it is. I have a cousin who's having a baby in the fall, and she's coming here in June for her baby shower. She doesn't normally live here, but she's driving through. So we're going to do like a family baby shower here. And I'm getting her the dosing guide and Tylenol and ibuprofen because everyone puts the Tylenol and ibuprofen on their wish list,
Registry.
right? On
Yes.
their registry, hoping they don't need it, but they have it because no one wants to be caught with a child with a fever and not have the medicine, right? So
Exactly.
now I want them to not feel caught without help with the medicine,
Okay,
right?
I love this. I
You don't
love
want a
it.
6-month old. You have the medicine, but you don't know what to do with it. That's not useful.
Better yet, get him the little caddy box, the cute little caddy box, the
Yeah.
thermometer, the infant ibuprofen, the infant Tylenol, the dosing guide, the
The
little
syringes.
syringe.
It's like your new
Yes.
diaper. What is they use? They call that the diaper cake,
Yes.
right? It's
Yes.
now your here's your first aid baby
Yes.
fever
Your
caddy.
medication
Your medication
dosing.
caddy.
Yes. I love
Yeah.
it. I love it. Well, this has been super helpful. I don't know. I mean, thankfully my kids lived through the medication and treatment that I gave them when I was half awake and with one eye open, but this is just saves you from that. So thank you for bringing the real facts, for helping us understand the difference between ibuprofen and Tylenol, that you can alternate them safely and that you can be less miserable and your children can be less miserable because you're covering all of the fever and pain together when you're doing this.
Mhm.
And then just a simple way to track it. I love a product
Yep.
that's made by a mom because we're in the trenches every day. We know
Yep.
what works. We have a high expectation of, like, of effectiveness. And so you went, there's nothing out here, so I'm just going to make this.
I'll
Like, you
just
didn't
make
have
it.
to, you just did.
So we did.
Yes, so you
Yeah.
did.
Yep.
Awesome. And also you have your own practice. So you have your own pharmacy business. So how do
Mhm.
people reach you or find more out about your pharmacy?
Yeah, so I do clinical pharmacy, which is most people think of a pharmacist in a dispensing role, right? You go to retail and they're the ones filling your medicines. I do more of the clinical side. I'm residency trained, so I know disease state management. So basically, if you have diabetes or high blood pressure or heart failure or who knows, yeah, so many different disease states. I manage medications to make sure you're taking the right medications. You're not overpaying for your medications. You're not having side effects from your medications. You're not taking too many medications, right? I basically optimize medications. So if you're ever interested, I that's usually adults because they're the ones who have these chronic diseases. But those are the people I've always worked with. And I'm at sacredheartcps.org. The CPS stands for Clinical Pharmacy Specialties. So sacredheartcps.org. There's so much information on there. There's a link to buy the dosing guide on there. But I know that Families of Character it focuses a lot of kiddos, but grandparents are part of the family too. So if you have parents or grandparents that need help with medications and have questions, you can always send them to my website too, and I'm more than happy to discuss and figure out what we can do to optimize those meds.
I love it because you're able to tell too medications interact with other
Oh, yeah.
medications and give awful side effects and then streamline things and cut things out. And like I was just
Mhm.
looking at your website and it would be so helpful to have someone personally look at your med list that maybe
Mhm.
isn't your physician that it's hard to get into or the specialist, but somebody that's knowledgeable about the medications and taking
Right.
them in combination with other things. And so I think most people don't even realize that this is like a service that's available and out there is
Mhm.
to talk to a live pharmacist, like
Yeah.
virtually over, over the computer or whatever, to look at the
Mhm.
meds and discuss the best treatment.
Yeah, and I would say on average, when I talk to someone, I usually find 2 or 3 medication issues. So either there's a side effect that is easily fixable and no one's even looked into it, or you're paying way too much for that medicine. Let's try this one. Or a really common one is you have two prescriptions that actually come in a combination tablet. Why don't we switch you to one tablet and save you a copay? So I always find something when there's a long list of medicines that I can easily optimize.
Mm.
And I mean, I love my patients. They've always been really thankful for me, and so I love it. I love this job.
Well, you do a great job helping people. I know that because I know you personally too. Check her out, Brittany Todd, sacredheartcps.org, and get a copy of the dosing guide. We've got that linked in the show notes, so it's easy for you to just click on the show notes and boom, put it in your cart and get it on your doorstep in a day or two. Brittany,
Sure.
thank you so much for coming on the Families of Characters show. Guys, I will catch you on another episode real soon. Take care and maintain your sanity.